Hello and welcome to Coronavirus Report. I'm here with Pastor Stephen Bohr, President and Speaker for Secrets Unsealed. I'm C.A. Murray, and our resource person is our Board Chair and the Chief Medical Officer for Kings County, Dr. Milton Teske. Doctor, good to have you here. Pastor, good to have you here. This program has been eagerly watched by so many people, and Pastor, I know you have actually a communication, I don't know if it's email or message that was sent to you that we're going to ask you to read it this time. It kind of bespeaks the value that this program is to our viewing public.
Yeah, this message is from a good friend. He's a physician who works in the Houston area. And he sent me this email. We're on a first name basis because I've known him since I worked in New Jersey 3 or 4 decades ago. So this is what he wrote. I hope you and your family are doing well in the midst of these difficult times. I want to congratulate SUMtv for the outstanding television programming. I just watched the coronavirus update with Dr. Milton Teske. It was an accurate summary of our current understanding how the COVID-19 works, systemically damaging the vascular endothelium. I encourage some to broadcast it more frequently and also to translate it to other languages. It may help medical personnel involved in the treatment of these patients to better understand the pathophysiology of this highly contagious and deadly disease and provide better medical care. Blessings. So this is a physician, colleague of yours, who has appreciated the comments that you've made. He's a very well-known and prominent physician. And so thank you so much for being willing to do this every week.
You know, the more we understand about any aspect of physiology or medicine or science, the better we are prepared to relate to it rationally and appropriately. You know, God, with His great wisdom, understands everything and always knows what to do. But God shares wisdom with us, and through science, we can begin to understand some of these things and understand how to best relate to them, what we can do to cooperate with God in healing and surviving the evils that have been brought on this world.
You know, it kind of reminds me, Ellen White wrote that the first thing that students should learn in school is the laws of physiology. So
Yeah.
how the body functions, in other words, the different systems, the different organs, how they function, and how to care for them.
Yeah, the more you understand, the more logical and sense it makes to do the right thing in regards to health. If we actually thought about what was happening to our arteries, we would eat very differently.
Yep, that's for sure, and drink differently too.
Good doctor, I have been on the phone this morning with a pastor friend of mine in New York City. He's right there in Long Island. And he's been watching the program along with others in New York State. One of the gifts you have, and we'll give you your flowers while you can still smell them, is that you have the ability to make what can be fairly complex simple. Everybody doesn't have that ability, but when you're finished discussing a subject, you paint word pictures, first of all. And secondly, you walk us through this kind of thing, non-dramatic. You don't put out any unnecessary fear. You kind of tell it like it is and simplify it. And really, that's what we kind of need at this point in time. We don't need to make it any more complex than it is. It needs to be simplified or sensational, well said, so that we can understand what we're dealing with in a kind of reasonable, rational manner without excess and undue hubris or hyperbole. So we want to thank you for that. God has given you that gift, and we thank you for that.
So what's been happening in the Valley? Can we have a little report on what's happening in the Central Valley?
Yeah, here in the Central Valley, things have pretty much been going along. We continue to rack up more cases as we do more testing. We find more positive people. The healthcare system has not been overwhelmed, which is good. We've had several major outbreaks in meat packing plant and food processing plant. again, the reason, if you just think about it, if you understand a little bit of how those businesses work, they have a lot of people working side by side on assembly lines, chopping the meat and packing the fruits and vegetables, whatever, you know, they're processing. They just have a lot of people all together in one place working closely together. And so it's an environment where it's easy to spread. You remember the cruise ship, I mean, was our first big introduction to this phenomena with this virus, and you realize that you put a whole bunch of people together in a space, the virus is very contagious. It's going to spread easily. The good news is that in spite of these outbreaks, we haven't ended up with a situation like New Orleans or New York where the healthcare system has been pushed to the max and overflowing, and there's not ICU beds and ventilators, and you know, the dead bodies are piling up in trucks and vans. That hasn't happened here in the valley. We seem to be spared from that and so far, and hopefully we'll continue to be. It could be that we're just later in some ways because, well, it'll come here later, but it also can be a difference in just the spread of the city, the sooner that we put in some of the protective measures, the non-pharmacological measures they refer to, where we stay at home, we social distance and those type of things. And so it may be that some of that stuff is contributing to that.
So have some of these areas like New York, New Orleans, Detroit, and so on, have they actually reached the top of the curve and they're flattening the curve now? Or
it seems to be that's the case because they are getting, while they're still having new cases and lots of hospitalizations, you know, the number per day, it's like, you know, they were getting this many per day, now they're only getting this many new per day. So it seems to be tapering down in some of those areas. LA still seems to have a lot of cases, Bay Area, but again, you'll notice it goes with the large urban centers tend to have trouble, and probably the major factor is the population density there. You know, there are some that are concerned that the 5G that they are installing in the large cities and have in these cities is actually radiating and contributing to the thing there. That really, we don't know that for sure, but it's something to be considered. You know, there's a lot of things in a big city, but the simplest thing, if you want to look at it, is just population density. You have all these people crowded and living and working and interacting, you know, in a very dense environment. So it makes for the spread of the disease there.
So do you think the masks and the, you know, the social distancing, as well as maybe herd immunity, has a lot to do with the decrease?
Yeah, we probably don't have herd immunity yet, but we may be moving in that direction. The epidemiologists tell us it takes around 70% of the population to sort of once about 70% has been infected and is now immune, then you're probably considered pretty good for that. And one study they did in New York, they just did a screening, I think we mentioned it last time, just went to a supermarket and tested, several supermarkets, and they tested, you know, over 1,000 people. 21% of them were positive.
Wow.
So it would suggest that in New York City, you want to call it the herd immunity is over 20% at least. Wow. And that will continue to increase and spread as time passes. And if it can pass without us overwhelming the healthcare system, well, then it's probably a good thing.
Yeah, praise the Lord. You know what I'm thinking of, because you're talking about when you got a dense population crammed into a fairly small area, it's reasonable to expect you're going to have an outbreak there. Are we still looking for, I mean, one of the epicenters has been nursing homes. We have a lot of people crowded together who are old. And prisons. Have we monitored that comprehensively? Are we still expecting a large outbreak of the virus in prison situations and in situations where it may be latent right now, but it's coming because you've got all these guys or gals crammed together, and there's no way to separate them and to get the kind of distance you would need to help yourself out there.
Yeah, if you were in on the public health officers as we meet together and call and talk about these various issues, you would realize those are at the very top of the list of concerns right now. Because you not only have the density of people crammed together in the case of the nursing homes and assisted living places, the people that are crammed close together are, senior citizens, most of them with multiple diseases on multiple medications, highly vulnerable, the ones that are likely to have very serious complications and possibly fatal outcomes are there. So yeah, it's a very concerning situation, and our efforts really go way over the edge. They're doing everything we possibly can to protect those type of situations. I can tell you they're the ones in our county. I mean, they not only don't allow visitors in, the staff all has to mask up. We go in and test the staff. We really are doing everything we can to try to prevent that. At the jail, the same type of thing. We want to protect that close together, because if we get one case, it's going to spread through all of the other close cases there. Most of our jails do not have private rooms. You're in more dormitory type settings right there. People are crowded together and closely in contact, and was spread very rapidly. Where it has broken into prisons in various places, there was a number in China early on where it just immediately went through the entire prison very rapidly. I can tell you locally, our local county jail, beyond all of the usual things that they could do, like masking and things like protecting the doing everything they can to clean things, wash things, have people wash their hands, wash things that people touch frequently, all those internal things. They have really, you realize that if it breaks out there, it came from somewhere. And the staff, they've really gone careful to try to protect so that the staff do not bring it in. I mean, if you have in any business, if you've got a cough or some symptoms, you're supposed to stay home. But they've gone way beyond that and really, stay home, and you keep staying home, and they've really extensively excluding any possibility of staff bringing it in. They're vendors, like that bring supplies and different things and deliver to the prison. Before they can come in, they make them put on the full suit, the outfit, everything, as if you were in a hospital treating a COVID patient, to bring in the supplies, because, and they wash down the supply. They really want to do everything they can to protect and keep it out of those situations.
Check the temperature too, I'm sure.
Oh yeah.
Yeah. Pastor, you fly a lot normally. I fly a bit myself. American Airlines sent me something the other day. You may have gotten it also, where as you fly now, you have to wear a mask. The flight personnel will be wearing masks. They're wiping down everything in the plane. They're disinfecting the plane between flights a lot more. So they're really worried about, Doctor, I guess all industries, about a second wave coming through that would really be crippling, wouldn't it?
Yeah. And a second wave here will probably not come in by airplane. It will come in because of an increased activity, or here locally. The influenza virus has a very seasonal nature to it. Other coronaviruses, which cause common cold type symptoms, also have a seasonal thing. They tend to, in the fall, here in the Valley, I've been in emergency medicine in the ER, monitoring what goes on in the community for the last 36 years. And here in the Valley, when the fog sets in, the flu season comes in. When the fog seasons stop, the flu season fades off and goes away. And we don't know exactly why that is. I suspect it may have less to do with the weather per se on the virus, and more on the effect of the weather on people's behavior. Because during those seasons, you move indoors, you close the windows, we don't have fresh air, we don't have sunlight, two really valuable healing agents that God has put out there to sterilize and purify and clean up the environment for us. You know, we come in these things, and then you run the heater, and you have this, you know, deionized, heated, stuffy air being recycled. Everyone's crowding indoors and not going out and getting their exercise, and so that's tends to be, I think, the issue to much of the seasonality of it. But these viruses have a seasonality to it, and it may be that the decline and the improvement we're seeing across the nation right now could well be related to the good weather we're having here now. You know, it's really warmed up, the fog seems to be gone, it's warm and sunny every day, starting even to get a little bit hot in the afternoons. You know, so that may be having something to do with it, which means, wow, well, what's going to happen next fall when the cold weather starts coming in, when the fog settles in again here? Will we have a resurgence? That is a possibility. We'll just have to wait and see. We don't really know the answer to it. This will be our first summer cycle for this new virus that's been released on us.
The good pastor has been wanting us to get into lifestyle and the 8 laws of health for weeks, and we've always jumped on something, and the time goes so quickly. I want to ask you one question, then I want to get to that. We're hearing talk about, is it remdesivir or remdesivir? It's remdesivir.
Remdesivir.
Remdesivir. Give us a little update on that. Is it something that we can look forward to? Is it something that is effective? From your standpoint, what do you see?
Okay, so remdesivir is a antiviral drug. It's a medicine which actually blocks the action of the virus. It's an antiviral. It works on the RNA, in this case, the RNA of this virus. So it's an anti-RNA virus medication. You might think of it somewhat parallel to a drug many of you may be familiar with called Tamiflu. Tamiflu is an antiviral that's used for the influenza. And I would say it's not a magic cure. It's more like it probably helps a little bit. Tamiflu, when you take it, if you take it early on, right in the first day or two, well, then you'll have your course of that particular will be a few days shorter. Statistically, you know, you test a whole bunch of people, the ones that took it, they had a little bit shorter course of it.
Maybe a little less severe too?
Yeah. And that's the thinking. And certainly in someone who is very symptomatic, someone that's hospitalized, you know, where things are getting more serious, it's more, let's try everything. Yeah, let's give it to them. Let's see if we can get some, you know, benefit by blocking this virus with that. But I don't think it's like, wow, we'll pass this around and the virus will be gone. Okay. It'll be more like we can take it and maybe you'll have a little less symptoms.
Does it have any serious side effects?
You know, all drugs have side effects. And the side effects, if you want to think about it in a more broader scope, you know, God designed the body to work a certain way. He designed the immune system to work a certain way. And He designed our immune system to get us through life on this earth. And clear till the end of time. He plans our immune systems to protect us. He designed them to do that. And as a general principle, the best thing we can do is to cooperate with God's plans rather than, you know, interfering with them. The more drastically you interfere with them, the more likely there's going to be side effects, complications. This is going to affect this, this is going to affect this. You know, the body is extremely complex. And to think you can throw a drug in to fix one thing is a little bit naive, because everything affects everything else in the body. And we find that with most of the drugs and medications out there. Not saying there aren't times or places where they would be appropriate. I certainly wouldn't want to say, no, don't take this, you know. But on the other hand, really, the less drugs we take, the more we use the natural drugs. You know, these things here. You know, there's those limit. You know, God put a lot of stuff in here that's really good for us, that really enhances your immune system. I mean, just taking some lemon juice and water every morning when you get up does a lot of things for the body, not just, but one of the things is it helps your immune system. There's a lot of vitamin C in there. There's other substances in here that help the body's immune system. And we could start going through every fruit and vegetable and seed, and you start finding out that, wow, there's all kinds of stuff in here that help. Some of them we're beginning to understand. There's a number of different substances in garlic that are really good and in things. And the more we can use God's natural remedies and go down that road, I think we're going to find we're working in harmony with the way God designed our body to work.
You know, I'm more of a theologian than into medical issues. So I have a theological question. Did God create the immune system before or after sin? And if he created it before sin, why would it be? Because there were no infections and diseases before sin.
Okay, so you ask a theological question. Let me give you a theological answer. When did God create the plan of salvation?
Oh, in the days of eternity.
Okay, I think that's our answer.
So basically, he gave us an immune system knowing that perhaps if we made the wrong choice, we would need it.
You have to use it, yeah.
Correct?
Yeah, and I think to a certain degree, a properly functioning immune system probably has roles and functions in a perfect world. And we don't know what those are because we haven't lived in the perfect world. But, you know, we know that microbes have a role. We know that, you know, they're part of your digestive system and how everything works there. We know that they're essential. I mean, vitamin B12, which is absolutely essential for life, is only made by microbes. So we know that microbes are part of eternity's plan for life as God designed it, and the ability to respond to them in certain ways, respond to other things that weren't supposed to be in the body and get rid of them, just repairing damage. You know, we talk about, you know, cell mutates a little bit. Well, that's really sort of becoming precancerous or moving down the road to cancer. The immune system can identify that and get rid of it. Will that happen in a perfect world? Well, maybe. We don't know. I mean, there's ultraviolet light. Ultraviolet light can do those type of things. You know, I mean, I think even in a perfect world, we'll continue to grow new skin on a monthly basis. You replace your skin about once a month, and I think there's a lot of things about how God does, the intricacies about how God designed things to work that we'll continue to study and learn about throughout eternity. And I think we'll be surprised at some of the intricate, delicate balance that God put in these systems to make everything run just right.
It would be kind of difficult to be an evolutionist if you really studied the immune system. The immune system is only one system of many that we have, and yet it's so complex.
Yes.
It hasn't even been totally decoded.
Oh,
and
no.
there's so much more to study.
We're barely on the edge of the immune
So it
system
speaks
right
of
now.
a creator.
Yeah, it does. Almost everything does. Well, you know, you think about it. God put the potential there when he put this thing together. Once sin came, he didn't have to go back and re-engineer this to take care of a surprise that he wasn't aware of. He knew what was coming, and the preventative aspects that are in here were there from the beginning. I was not a lemon water drinker. My wife got me into that. So every morning, that's my job. You prepare the lemon water while she's in the shower. When she comes out, is it ready? Yeah, it's ready. So yeah, and it works every morning. We do the lemon water. So we serve a very faithful and a very thorough God.
In Latin America, lemon cures everything.
Very true. Very
I
true.
thought it was the jalapenos.
Well, that's only in Mexico.
Oh, okay. Well, that's as far as I'm going to get.
You know, I'm looking at our time. Touch on something very quick. I've been hearing, I just began to hear it the last couple of weeks, clovid toes. What is or what are clovid toes?
Okay, this COVID virus, we know this common respiratory symptoms of cough and fever and those type of things, but apparently can make a viral rash. And for some reason, this rash only appears on the feet or lower legs. So just the lower extremities down there, particularly the feet and toes, it's very similar in appearance to chickenpox rash. So you can add that to your list of symptoms to look for, along with loss of smell or taste, which might be there. There might or might not be this rash. It clears up and goes away when the infection passes, but it's another phenomenon they've discovered, and it's been identified. If you want to see a picture of it, just Google it. You can find it there. And so there is a rash.
You know, today we had lunch, and we practiced social distancing here, and Pastor Bohr said, "I can't smell the food." We said, "Go home."
You should have seen, because I said it very seriously. Yeah. You should have seen the faces of everybody at the table when I said that. They were ready to bail out.
Well, it's appropriate to be cautious in these times.
Because every week there's some new thing. You know, this virus takes so many forms and expresses itself in so many ways. There's something new almost every week, which is why we have to keep having you back here to sort of keep us up to date with this stuff. Yeah.
So we only have like 55 seconds left, not much time. I just want to take this opportunity to address everybody who's watching. We appreciate your support at Secrets Unsealed. First of all, your prayers, crucially important. And then we also appreciate your financial support. It's a blessing. It helps us continue preparing programs such as this that help the general public. So now I'll let CA bring it to a close.
We want to thank Dr. Teske. You know, it's a blessing for us to have the health officer for our county as chairman of our board, a committed Seventh-day Adventist physician. And I don't know if you can be better than that. A committed Christian physician is the best of both worlds. So we thank you for your support. We thank you for watching. We invite you to watch us again each week. New things coming each week. We have questions, we have answers, and we have our good doctor to help us work his way through all of this. And so until we see you again, we wish you God's very, very best.